of this session is Ayurveda, Yoga and Nathpan 2025. Before proceeding further, I humble request to coordinator of this session. I request Dr. Navodaya Raju sir, please guide our chair and co-chair to the dais. Raju sir, please introduce co-chair and chairperson.
Good afternoon, everyone. Me myself, Dr. Navodaya Raju, Associate Professor in the Department of Kriya Sharira, here to introduce today's chairperson and co-chairperson for the session 4, Dr. Shanti Bhushan R. Handu sir, a Ayurveda scholar and practitioner, holds BAMS and MD degree from RGHS Bangalore, currently serving as a professor and HOD in the Department of Samhita and Siddhanta at Guru Gorakhnath Institute of Medical Sciences, Gorakhpur. He is widely recognized for his contributions to the Ayurveda through research articles, publications, and presentations at various forums. He has been honored with numerous prestigious awards, including Rashtriya Vaidya Seva Ratna, Samaja Bhushana, and Guru Tilaka for his outstanding service to the field. His acclaimed works such as Arogyasri, Mental Health, and Shodasa Samskara reflects his dedication to the integrating knowledge, traditional wisdom with modern relevance. And today's co-chairperson, Dr. Viramra Sharma, Associate Professor in the Department of Rashastra and Vaishya Kalpana, is a distinguished academic and researcher in the field of Ayurveda with extensive qualifications including BSc and PhD from Banaras Hindu University. Additionally, he holds certificate course of yoga, professional for better life from BHU, foundation course in yoga sciences for medical professionals. Dr. Sharma currently serves as an associate professor in the current institution, that is Guru Gorakhnath Institute of Medical Sciences itself. Welcome you both, sir, chair and co-chair. Thank you for this opportunity. Now I hand over the session to the co-chair of the session for continuing with the lectures.
Hello. Thank you, Dr. Navodaya Raju ji. So, it is my privilege to introduce Dr. Prahlad V. Subbannavar sir, has made a significant contribution to academia and research. He is a valued member of the Board of Studies, Academic Council, Curriculum Committee, and the College Council additionally. In recognition of his academic excellence, Dr. Prahlad was honored with the Dr. D. Virendra Hegde Patti Vishak Award in 2008 for being the university topper in Rachna Sharir. More recently, in 2023, he was awarded the Teacher of the Year by Yenepoya, deemed to be university. He was also received Best Paper Presentation, Kalana Vaishana in 2019, and the second Best Paper, Agni Chikitsa at Mahatma Gandhi Ayurveda Medical College. Dr. Prahlad is deeply committed to advancing research in this field. He currently supervisor of 2 students research program with the ongoing study on herbal oil formulation and age-related challenges in the knee joint. His work has been widely published with the 12 articles across high-impact journals, including PubMed, JAMS, etc. An active participation in the academic event, he has attended 27 seminars and the workshop at the national, international, and state level, further contributing to the growth of knowledge in his discipline. With this brief introduction, I request Dr. Prahlad V. Subbannavar sir, please come on the dais. So now the dice is yours.
Guruభ్యో Namaha. Om Dhanvantare Namaha. Respected stalwarts of Ayurveda and the people who are coming from different parts of this uh, country and representing from your individual specialities. With due respect to my teacher, Professor Muralidhar Sharma, is a professor emeritus, is working in SDM Ayurveda College, Udupi. So under his guidance, I uh, just one effort I just made, and then today's chair and co-chairperson. So I also thank you for this opportunity what you have provided me. So this is a small topic where during my PG's days we have some kind of discussions on the topic of Marma. So today's presentation I have divided into three divisions. So first one we'll see about the concept of Marma or Marma Sthana and the Marma Vastu. And second part is about some kind of where I just compare to the stroke syndrome, that is the cerebrovascular accidents. And third part is the part related to the pathophysiology of both the sector, right? In the uh, Marma Aghata Lakshanas related to the pathophysiology of the stroke. And in the conclusion, I have highlighted one or two points which is related to your one concept Acharya Charaka explained about the uh, dosha abhigata or maybe abhyantaragata aghata lakshanas. So I just divided in these three or four simple divisions, and I'll go ahead with the first slide. So first, as I told, Marma or Marmasthana, where we study about this in first year BAMS about the topic as academic part, and in case of some parts of Kerala, they practice this Marma or Varma Chikitsa, they tell it as. But as a teacher of post graduation and a teacher of this UG students, we always have a kind of confusion and not a clarity about the subjects. So here we have to follow what Acharya Shushruta mentioned in the name of the marmas and the sthanas of marmas of 108, and that the importance of these marma sthanas, which we have to protect for the to safeguard our health. So these are the few spaces or the regions where the marmas are classified. So this one, especially, I am highlighting here the marmas which are located at the shiras in the head region. At that part, few marmas are explained, which is because as I've taken the contemporary cerebral stroke, so I'm just considering this point to the head region. And the second part is the tissue level understanding. That is also it is required for us. We have to, because Acharya Shushruta also classified into 5 class types like Mamsa, Sira, Snayu, Asthi, and Sandhi Marma. So here I am taking this point only to the Sira Marma. So Sira Marma means most of us will know only veins and most of the text translated into veins, but rather I am keeping this as a blood vessel. So simple, if you consider the blood vessel as a Sira, so then it will be more ideal to give up to the conclusions. So this is a part which is about this. Then Acharya Shushruta also mentioned about the importance or the vulnerability of these regions where any aghata or any injury may lead to this. So he has explained prayena to krichatama bhavanti narasya etra sadhyamanaha. So whatever the treatment we plan, it will be very much not clear or cannot be cured completely. So here again, as we go through all the contents, what morning we have also heard from our Chancellor and Maharaj that yavanto hi murtimanto tavantaha. So whatever you find outside will have inside. That is what the Soma Maruta. So Marma means it's not a simple anatomical structure. Rather, it has got all the particular ingredients compared to the Sattva, Rajas, Tamas, and all Pancha Mahabhuta predominance. He has highlighted in the classification like all the 5 types are predominant in each particular Mahabhutas. So in second part, Tatakshate Maramanita Pravruddha Samantato Vayurabhistranoti. So he has classified concept of Vata. So where it is important, where Acharya Charaka also mentioned about the sthana of Vata or the Mula sthana of Pranavasrotas. Some of the authors also mentioned about the Mula sthana of Pranavasrotas in Shiras. So compared to that particular point also, I am just taking that where one Marma Vastu is there and one Vata is there, and then it's going to produce a kind of the symptoms which can be correlated to the contemporary science. So here, as I told, I am only considering here as a Sira Marma only. So there in Sira Marma, if you consider about the Sira basically, so there are some definitions which are taken from the Charaka and Shushruta, where the function of the Sira will be by the role of or by the help of Pavana. So that is a Vata. These particular fluids or maybe the parts which are flowing through the blood vessels. So where he definitely classified Manat Dhamanyah Sravanat Srotamsi Saranat Siraha. So Sarana is by the predominance of Vata dosha. Coming to the next point. So where in case of Charaka explained about the Shiras. Now after the Marma Vastu Sira, I am coming to the part related to Shiras. So he has given the comparison with sun and the rays. So how these particular rays are eliminating from the Surya or maybe a sun. Like that, he told that Shirasi Indriyani Indriya Pranavahani cha Srotamsi Suryamiva Gavastaya Srotam. That is what the Shiras is the important point where all the functions, you keep it as a metabolic functions or maybe a neurological functions which are connected to the Shiras. So the head has been identified the physical location of Indriyas from the discoveries of Indriya Buddhi and likewise. Also explained about the Indriya and Indriyartha. In the concept of Indriya and Indriyartha also are located at the part of Shiras. So here again, some as Marma is classified into different types. Here also it is classified. Shiras are classified into different types. And the second shloka, Tatakshate Marmanitah Paravruddha Samantatoho Vairabhisrunoti Vivardhamana Sutamacharisharujah Sutira Pratanoti Kai. That is, even though that impact or injury, if it happens to the particular regions, which region is more dominant in this Marma, that is, it's a Ruja Vibhutam Tata Shariram Praliyate Nashate Chasya Samnyaha. So that is definitely it will going to have the impairment or maybe a disabilities which can be seen especially in the region of Marmasthanas. So here I'm just again coming back to the Shiras and Marmas. So here in the Shiras, these are the few names of the Siras which are located. It's called as Neela, Dhamani, Matraka, Shringataka, Apanga, Stapani, Phana. So they are the names of the Marma, Sira Marma, which are located at the part of Shiras. And also, Shushruta also emphasized more on numbers also. These numbers of Siras which are located at the Shiras. And coming to the Shiras, like what I told in the beginning, Pranaha, Pranapratam, Yatrashata, Sarvendriyani, it Uttamangama. So he has used the word Uttamanga. Shiras, he also used a word called Uttamanga. And now I am gradually just completing this first part where after Marma Vastu, then about Shiras, and then coming back to the symptomatology, what Acharya Shushruta mentioned related to the Siro Marma Abhigata, that is Shiro Abhyasite Manya Stamba, Ardita, Chakshu Vibramana, Mohana, Dveshtana, Cheshtanasha, Kasa, Shwasa. So these are the few symptoms which are more related to your neurological functions. Most of these they have given, he has emphasized more on the neurological entities. Now, my second part is about the stroke, where again I am limiting myself to the blood vessels which are supplying to the brain, where stroke is a clinically defined as a syndrome of acute focal neurological deficit attributed to the vascular injury. So both things are included here. Either it is infarction or it may be hemorrhage. because both were caused by the blood vessels. And stroke is the second leading cause of death and disability worldwide. The stroke is not a single disease, but can be caused a wide range of risk factors. So this, I think, this is one scenario where about the fact sheet of the previous 2 years back it has taken about the strokes, especially cerebrovascular accidents, which they are taken up. One uh, vulnerable point here is to see that it has increased up to 50%. Now the conditions of coming to the, if you take a statistics of the global or maybe in your nation also, we have got more number of 1:4. Now it has stroke is so expected in 1:4, at least they will get in their lifetime. So this is what the other contemporary concept of the stroke, where I am taking or I am comparing with my particular Marma Aghata Lakshanas. So how this stroke enhances. So if you keep the particular basics, like 50 ml per 100 gram per minute is the requirement of the blood or maybe oxygen to the brain tissue, which is very much high compared to the other structures like a bone or maybe muscle tissue. So metabolically, only it is active when it reaches about 50 ml per 100 gram. So if the blood flows drops below 100 or 10 ml per 100 gram, so then it starts to deteriorate. So once it comes down to the 10 ml, even if it goes below 5 ml per minute, then obviously the brain tissue will not work properly and it will deteriorate completely. So the condition may be result into hypoxia or maybe hypoglycemia, which lead to the infarction of the brain tissue. So when it is infarction, that leads to the hypoxia and hypoglycemia. In case of hemorrhage, the hematoma. So in other regions, you'll have a hematoma. That hematoma compresses the brain tissue, which the functions are carried out by the brain. So these are the two instances where either ischemic stroke or it may be hemorrhagic stroke. So both are included in our cerebrovascular accidents. I'm not going to deal in detail about these things, but these are the few points where we have to consider only related to the blood vessels. So there are the just a chart which is showing that about the blood vessels which are around the particular part, how they will be derived and then can produce into the conditions. And one more point, I'm here to just see that in generally we take classes and in discussion we tell that marma ghata means death. When you have an injury, then death will occur. So usually it's not like that. There generally we don't consider a tissue death, rather we consider a whole of an individual. So that is what we have to change our particular the mentality about that. Here we'll also consider the tissue death. So where in contemporary also they have specified non-traumatic brain injuries. So if it's a trauma is there, fine, it definitely produced to the some head injuries or maybe. But if it is non-traumatic injury, that is the called as ABI, acquired brain injury, that causes damage to the brain by internal factors such as lack of oxygen, exposure to toxins, or pressure from the tumor. So later stage, I will explain about the our own concept, what Shushruta or maybe Charaka explained about the pathophysiology of our marmaghatas. Right. So here maybe a comparative point we can take it out. There in contemporary science, they have given this kind of cognitive, perceptual, physical, behavioral, emotional. So these are the changes which can be observed in the particular the stroke syndromes. If you look at our science, where the Shirogata or Sira Marma Viddha Lakshana explained, almost similar. Moha, Udveshtana, Cheshtanasha, Gadgadita, Akshinmalana, Lalasrava, Swarahani. So almost similar symptoms are explained in the particular our science also. So then there'll be some interpretation can be made here. The vessels which cause the damage leads to a variety of the disorders affecting both brain structure and functions. In similar fashion, the vessels where I am considering here is as a Sira or the blood vessel, where definitely it's a Sira Marma structures can lead to the same clinical entities. As we have seen in the previous slide, almost the clinical manifestations are matching together when these blood vessels are injured. So here the concept starts about the dosha abhigata. So in case of dosha abhigata, we can see that Acharya has mentioned the damage to these vessels, which are not only results in traumatic, so we have to bifurcate into traumatic and non-traumatic. So if you consider the non-traumatic conditions where this may be correlated to the atherothromboembolism or maybe a thromboembolism. So our particular consideration, what I'm just focusing on this uh, abhyantara dosha gata or maybe a uh, dosha abhigata, which is not happening outside, maybe inside. So that can be compared about these particular conditions. So coming to my particular conclusions, one more point which is seen here, where one more additional point we can add it on, like the Charaka explained about the uh, roga utpatti. So usually most of the diseases are classified into Trivida Roga Margas. So generally we'll have this Madhyama Roga Marga. So in Madhyama Roga Marga, Marma sthanas are explained well. So that may be the very ideal concept, or Acharya Shushruta Charaka has this kind of the detailed knowledge about the importance of blood vessels and shiras and other tissues, what we are knowing through now. Coming back to this first conclusion, that is vitiated vata in siras raised to the point called as Sira Shunyata, Sira Tanutva, and Sira Mahatva. Evident that vata is the primary cause of these symptoms, where we have discussed earlier, which are indicative of kind of tissues and vascular injuries called as dosha abhigata. Coming to my second particular conclusive point, that is marma abhigata stuta kadishchanti ovalpa. That is, injuring resulting in these marma locations undoubtedly cause the tissue death or the death of an individual. Both can be considered depending on the marma which is involved in this condition. And next is the treatment modalities, what Shushruta mentioned, may not yield adequate results for disorders of lesions affecting the marma side. So this is also very important lesson for us. Even though we try much on treating these kind of conditions, the result of the prognosis is very poor, because as we have gone through so many previous slides about the places and the dosha sthanas and the blood vessels where, and especially it is happening in the Shiras region. So even though we may be able to treat it, but result cannot be expected in a very good manner. Next is where I discussed just about the dosha abhigata madhyama roga marga, where Acharya has mentioned about the Trayo roga marga iti shakha marma sandhi or marmasti sandayah koshtascha marmani punar basti hridaya murdha. That is again the point is shiras, and they are considered as a madhyama roga marga. So the specific association in pathological courses referred as roga marga, and therefore the dosha gati in these particular margas are totally different. So the any disease which is coming from this madhyama roga marga, especially the marma injury, which is very vulnerable. Right. So the reason Acharya has mentioned the kritra sadhyata of madhyama roga marga is because the organs what he included, all these important vital organs what he has noted there, obviously they are going to cause a severe vulnerability. So stroke entities can be compared to the concept of Sira Marma Viddha Lakshanas, particularly the vascular pathologies. So Sira Marma I am comparing to the vascular pathologies, and all non-traumatic brain pathologies can be considered as dosha abhigata, and variety diseases as these are categorized under the Madhyama Roga Marga. So this particular attempt is made to a new approach in comprehending the clinical conditions related to Marma, which is a significant section where we generally study and we forget in the first Sharirasthan. Generally in the first year, we study for the examination or academic purpose and we leave about this. So numerous entities associated with Madhyama Marga categorized dosha abhigata janya. So therefore, the treatment modality or whatever the protocol we plan it for the treating such diseases can be little bit changed or maybe taken up, where you can see in the patient of Kaya Chikitsa OPD or maybe a Panchakarma OPD where the patient comes directly with these conditions. So rather this Marma concept can be considered one of the protocol where you can have your case sheets which can highlight is the points which is related to the involvement of this particular Marma. So even though Acharya told it is prognosis is very bad, but our approach may be changed. by going through this. So most of the conditions, Marma is related to only surgical, maybe a kind of traumatic conditions. Instead of that, if we consider from the other parts also, it will be uh, any new ideas or new contributions may also come up with this particular concept. So by this, I'm going to conclude my session. Uh, so again, I thank all the organizers and chair and co-chair who has given me the opportunity. Thank you, sir.
Now the session is open for discussion. Okay, thank you, sir. I thanks Dr. Prahlad, sir, for a wonderful session.
Related to Marma therapy, I am working in the field of Marma therapy also for the management of non-invasive treatment modalities for the pain management. Many times I have found many more results, and excellent results were observed during the frozen shoulder and migraine and other things. But here I would like to ask to share your experiences with me that being a person in the field of anesthesiology, when a patient is unconscious, especially in CVA, it may be traumatic or some sort of intrinsic factor stimulated. So, under circumstances, what are the Marma points you use to apply for the to return the consciousness level of a patient who is under CVA? You don't have.
I thank and appreciate sir's valuable input in this. Sir's question is about the concept or the part related to anesthesiology. No. Yeah. Please, sir. Can you repeat this?
I'm unable to explain my question. This is that when a patient is unconscious and in a state of CVA, and the patient comes to Ayurvedic physician, and we have an analytical or diagnostic as per the principles of Ayurveda, then we have an alternative to refer the patients for the sake of his life, because human life is very precious. So, what are our limitations? If it is curable with the Marma therapy, with the Sringatak and the Manya and other nerve stimulation, can we restore an unconscious patient to the normal conscious state? My question is that.
So thank you, sir, for your inputs. So the point is very clear here. So where we have some limitations, because the patients what you're getting now is totally different what Achar has mentioned in the earlier stage. Now the patient is having the pre-existing diseases where our the intervention of Marma Chikitsa generally what, because my topic is only the uh, part of Marma, understanding of Marma. I am not entered into the Chikitsa of the Marma. Okay. Second point is we have some limitations, and as far as my knowledge goes, that I don't have any confidence in just making this kind of intervention in the patients who are coming to the IPD or maybe casualty in the hospital. But still, I want to tell you one more additional point where in some parts of the Karnataka we practice, especially most of you heard some name like Muralidhar Sharma and Ravi Shankar Parvaje. So they have this kind of concept called as Agni Chikitsa. So if patient comes in a very fresh state of just 48 hours, within 48 hours, the status of this the stroke syndrome, they have their own specialized. It's not Marma Chikitsa. It's not Marma Chikitsa, but they have this specific Chikitsa called as Agni Chikitsa, where they have two particular combination of one particular Panchakarma and Agni Chikitsa, where deciding on the factor whether it is a hemorrhagic or it may be a infarct. So if the because clinical manifestation will definitely give you the idea about whether it is hemorrhagic or it may be infarct. So in case of infarctive point, they have their own treatment modalities where patients are somewhat cured or maybe some drastic complications may be reduced. That we have seen, and it's still practiced in SDM ODP, the Agni Chikitsa.
Dr. Pervaje and Murali Krishna is my close friends. Huh? They were just 1 year senior to me. Dr. Pervaje, you asked my name, they gave it. अगर कोई मरीज बेहोश है, ठीक है ना, और आपको समझता है कि आप आयुर्वेद के डॉक्टर हो और रात में अचानक ऐसी दूर अवस्था में आप पड़े हो कि आपके पास कुछ नहीं है, दूर दराज में आपके पास सिर्फ 3 मिनट है, अदरवाइज ब्रेन हाइपोक्सिया हो जाएगा। उस टाइम पे आपको कुछ नहीं करना है, पेशेंट को हार्ड सरफेस पे लिटा के चिन को ऊपर करके आंखें 90 डिग्री आसमान में देखे और आंख के ऊपर ये जो जगह होती है आईब्रो के बीच में थोड़ा सा प्रेशर दो, मरीज आंख खोल देगा। पहला। दूसरा, उसकी टुड्डी को नीचे करो, जांघ को लिफ्ट करो, सांस लेना शुरू करो। इमरजेंसी में ये आयुर्वेद के मर्म पॉइंट्स हैं जो कि इनके सीवियर स्ट्रोक से टैली करते हैं। अनप्रोसेस्ड होता है ट्रांजिएंट स्पाइनल आर्टरी ऑक्लूजन सिंड्रोम, ब्लैकआउट होगा, उसके बाद फिर पेशेंट को चक्कर आएगा, गिर जाएगा। अगर फ्रीक्वेंसी एक महीने में 4 से 5 बार होती है, हफ्ते में 2 से 3 बार होती है, तुरंत उसकी एमआरआई करो। अदरवाइज अगर कोई ऐसा पेशेंट आपके जीवन में कहीं मिल जाए, तुरंत हार्ट सरफेस लिटा के उसके आईब्रो के बीचों बीच में थंब से प्रेशर दो और जब आपको लिफ्ट करके खोलने की कोशिश करो, मरीज तुरंत बच जाएगा। 3 मिनट नहीं होना चाहिए बस। ये है मर्म।
Thank you, sir. Thank you. Thanks.
Thank you, sir. I request the co-chairperson, Dr. Vinamra Sharma, sir, to introduce Professor Mariam Unyal, sir. Sorry.